I work in a hematology oncology bone marrow transplant unit. My patients do not have an immune system. If they come close to any virus or infection, they can die. And the thought that they rely on my health in order for them to survive the chemo rounds and their treatment is very stressful.
Hi, everyone, and welcome back to COVID-19 Heroes. Today, I have the honor of speaking with Michelle Santizo. Michelle is a bedside nurse working for UCLA Health at the Ronald Reagan Medical Center. She reports from the front lines of the COVID-19 response, describing what it's like going to work without proper personal protective equipment, or PPE, what lessons the government will hopefully draw from this pandemic, and what organizations like UNICEF are doing during this crisis to help children around the world. Hi, Michelle. Thank you for joining us on today's episode of COVID-19 Heroes.
Hi, Lorraine. Thank you for having me.
I greatly appreciate you being on this podcast as you are a frontline worker in this pandemic response, currently working as a registered nurse for UCLA Health. Can you please describe your position to us?
Yes, of course. I have been a nurse for 5 years now, and I work at the UCLA Hematology Oncology Bone Marrow Transplant Unit as a bedside nurse.
So how has your work been impacted by COVID-19 in recent weeks?
So, as many of you have noticed and are aware, and you have seen the lack of rapid response the nation has taken throughout our whole nation and the hospitals. Although UCLA has made strides from the impacts of COVID-19, there's so many concerns and issues that remain unclear or uncertain. For instance, prior to the COVID-19, personal protective equipment was readily available for all nurses. And as of now, we've had to count how many masks we are given a day. N95s are now kept in the charge nurse office. And every time we need a mask, we have to ask for permission. UCLA is saying that that's a way of them keeping track of how many masks they're using, just in case, they're trying to prepare for this surge that they're thinking might happen in the coming weeks, just like how New York has had the surge of patients coming in. So the mask is one issue that we've had. Before we used to just have open access to it, and now it's just limited, or we have to ask for permission. And also just continuing the fight on keeping higher standards of protection for all frontline workers. There's this discussion versus masks versus N95s. And while many nurses feel uncertain and feel the need to wear an N95 while caring for a patient with COVID-19, administration continues to push that a need of wearing N95 should only be allowed to be used for COVID-19 positive patients receiving aerosol or breathing treatments. So this virus is still very new to the world, and the uncertainty of how the virus spreads is still unclear. I understand there's a lot of guidelines that state is transmitted via droplets. There's some data that says the virus can live in the air up to 3 hours or so. While the research continues to evolve, I believe nurses and healthcare workers should be allowed to use the highest level of protection, including N95s, across the board for all healthcare frontline workers. I believe if we have the available N95s, why not use them now? Why do we have to use them or wait to use them later? The issue is we need protection now, not next week or the following month. We need it now. I've asked to use the N95 when we were testing patients for COVID-19, and I've gotten pushback on, no, this is not the protocol we're following. You're only supposed to use a mask. You're only allowed to use N95 when a patient's undergoing aerosol or breathing treatments. And it continues to be a battle. And I get my clinical judgment and expertise being questioned. I feel like I should be able to use an N95 if I feel like I need to.
So today it's April 1st when we're recording. Do you think that the rationale behind these protocols is that we have not reached the peak yet here in California or in Los Angeles, and we're just waiting for that peak to hit before you have access to masks on a more regular basis?
Yeah, so that is the discussion currently, that they keep mentioning we're not at a shortage of PPE whatsoever, but yet they're counting the masks that we're given a day or allowed to have. And we're also being sent all these emails with saying we're accepting donations and we're so thankful for all the donors that have donated all these masks. And yeah, they keep saying, we're not running low on PPE. We're waiting for that surge to come. So when it does come, we're prepared. And in my thought is just, we need to be prepared now, today, not in a week or in a month.
Because you might get the virus, you might catch the virus between now and then if you're not properly protected.
Exactly. That's the continuing battle that we have as nurses and frontline healthcare workers, is just we are asking for the highest standard of protective equipment. We're asking to use it now. We have evidence. Okay, great. Evidence in science is amazing, and I don't doubt that. But it's a new virus. We don't have enough evidence to really create that certainty or ease the anxiety of whether is it droplets or is it airborne. It's too soon to tell. So why not wear our highest possible standard of protective equipment, which is using N95? And that continues to be a battle.
Yeah, it certainly does not appease your mind while you're at work. No, not knowing what exactly you're dealing with and having that uncertainty loom over your head. Have you been talking with other nurses elsewhere about their conditions what they're experiencing?
Yeah, so I've had the pleasure of meeting a lot of nurses throughout our nation in the U.S., and I know nurses from Washington, D.C. I used to work in Washington, D.C. I have friends in New York, in Ohio, Arizona, and different areas in California. And yes, I've heard the stories. I'm in constant contact with my friend from New York that tells me all the terrifying stories. I just got off the phone with her just a minute ago before I called. I was on the line here. She has to sign off an N95 mask with her charge nurse in one shift. So one shift is about 12 hours or more, depending if they have to stay overtime or whatnot. And they have to wear that N95 for the whole entire day. Covering the N95, they have to wear a surgical mask. And just to provide a perspective to just the general audience, when we take care of a patient, one specific patient that requires a mask, and let's say the patient is calling me because they want a medication. Before I go into the patient's room, I wear that mask that I need to wear, either surgical or N95. So I put on my mask, I see my patient, I give them their medication, I come out of the room, I take off my mask, and I throw it away. We do not reuse a mask because that mask can harbor particles or bacteria or whatnot, different things within that mask. And we don't wear it to our other patient's room or wear it through our nurse's station or wear it while we're talking to our colleagues. And in New York, my friend has to wear her N95 for 12 hours to see one patient, the next patient, the following patient, and wear it throughout her stay of 12 hours while she's speaking to her colleagues, speaking to the medicine team. That's not acceptable. Since when did guidelines weaken? Since when was it okay to just wear one mask throughout the whole entire shift? That is just shocking to me. And she keeps telling me, oh, we don't have a shortage of PPE. And I was just questioning her right now. Well, if you keep saying you don't have a shortage of PPE, then why is it that you're wearing an N95 for the whole entire day? She told me, well, that's what her CNO, chief nursing officer, told her. But I mean, that's not okay.
Clearly, there's a lack of transparency and a lack of communication embedded in that as well.
Of course.
Have scenarios like pandemics been part of your curriculum becoming an RN? Is that part of classes or exercises that you have been a part of in the last few years, whether it was on the job or in nursing school?
So, like I mentioned before, our nation and UCLA and many other hospitals was not prepared to handle a pandemic like in this magnitude before. We've had many other outbreaks of viruses like SARS, Ebola, H1N1, but we still are not prepared until this day. When I became a nurse and I graduated, I took an oath as a nurse to care for the sick in all kinds of instances. I made a commitment to lend a helping hand to those who need my help. I knew coming in as a nurse, as a frontline nurse, I would be exposed to viruses, bacteria, chemical exposures, bodily fluids of any kind. But I didn't know that I would come to work one day without having the option of the appropriate PPE or being questioned of which PPE, surgical mask, or N95 I should wear. Honestly, I don't think anyone was prepared for this. Yeah, that still remains something that hasn't been invested within our nation, let alone our state and our hospitals.
And I would agree with you that, I mean, certainly there are some people who, most likely immunologists and epidemiologists, who have really thought about these scenarios, but also coming in with my background as an emergency manager and previously working at UCLA and with the group at UCLA Health. And just in general, in emergency management, we do have exercises. We run through exercises every year, multiple times a year. I know that healthcare facilities, they all participate in annual exercises. LA County has a big annual exercise every year. But I think it's really, like you said, the magnitude of it all, the fact that it's a pandemic, the fact that you cannot rely on other countries, on other states, on other cities to help with that lack in supply chain and in PPE, that is really such a catastrophic scenario. And we have not done a good job previously in really testing out those scenarios, because typically we, the pushback from leadership or whoever is, oh, well, that would never happen. That would never happen. This is unrealistic. And now it's hit us full face. And the magnitude is beyond anything we've experienced with other emergencies before, except, obviously going back to flu of 1918. But I think it's definitely a huge wake-up call to everyone, from healthcare to emergency management to supply chain to everything.
I agree 100%.
So on one hand, we get told, well, there's no shortage in PPE. At the same time, we are rationing PPE. What would you like to see from leadership, whether it's, where you work or on a state level or federal level right now? How would you feel supported in this?
Yeah, so like I mentioned before, like how you said it perfectly, our nation is not supporting us. Organizations like CDC, World Health Organization are weakening their guidelines of PPE. I mean, not too long ago, CDC recommended at a time of shortage of masks to wear bandanas. Since when does microbiology and science go out the window is my question. Despite the shortage of PPE, there should never be guidelines putting nurses and healthcare workers at risk in the front lines. And locally here in California, I feel the same way. California should know better and adopt stricter guidelines for frontline workers. And when nurses speak, administration should listen. After all, nurses and doctors and healthcare frontline workers are the ones working around the clock caring for patients on the floor. Administrators can sometimes get bogged up by the numbers or finances, but this is not the time to count dollars. This is time to step up for people's lives, in which are more valuable than making or preserving a dollar. I'm not sorry, but my patients and families and friends' lives are important to me. And that's why I'm here today speaking up.
And by you not having the proper PPE, it makes you feel like you're not being valued and your life is not as respected as somebody else's maybe.
We're the ones working on the floor, seeing what works best. Administrators, I appreciate their job. I understand they make a lot of difficult decisions. But at the end of the day, we're the very first people that see the virus first, come in contact with it first. Administrators are seeing it from afar.
Yeah, and it certainly doesn't help anyone if the frontline workers working at the hospitals, they get sick and then there's nobody to care for the patients. So since you are incurring the risk of exposing yourself while going to work every day, what steps are you taking to prevent contracting or spreading the virus?
Just like how any other California resident or a nation should be taking is staying home when you don't need to be out in the public. As a nurse, I'm using the same protocols I've been using, but a little bit stricter. I'm washing my hands a lot more with water and soap, using hand sanitizers if they're still available, because there's a shortage on hand sanitizers too. And before I come home, I strip down with all my clothes and I put them in the wash immediately. And then I take a full body shower and hope that I don't develop any COVID-19 symptoms.
Do you live with anyone?
I do live with my parents. My mom, she's turning 64 this year. And then my dad is 59. And I also live with my brother, who is 27. There's 4 of us in the house. So when I do come home, I'm not thinking about myself per se, but I'm thinking about my family. If I get sick, I worry about my mother and my father and my brother. I could give it to them, and they didn't sign up for this. They didn't sign up to get sick. Yeah, I mean, it's a scary thought to think that I can potentially give them something deadly and then live with that for the rest of my life.
Yeah, I think that's something that maybe not everyone realizes when we are talking about frontline workers, is that it's not just about them, but it's also about the people they live with and putting them at risk as well. So the number of people that could contract the virus is huge. You specifically work with patients who are very sick. What is it like for them? How have they brought up concerns and what goes through their minds because they know that they are vulnerable to the virus?
So I work in a hematology oncology bone marrow transplant unit. To get an understanding of this specific population, my patients come in for chemo or have or underwent multiple rounds of chemo throughout their hospital stay. My patients do not have an immune system like the general healthy person does. If they come close to any virus or infection, they can die. So my patients already come in with fear and anxiety, but with the added COVID-19 stress, it creates another layer of stress and uncertainty. My patients ask me directly all the time, you as a nurse, are you being tested? How certain are you that I will not get the COVID-19 virus? Being asked those questions and I myself having that anxiety and fear, it's very stressful. And let me remind you that I work with my patients 12 hours in a given day. I form bonds and relationship with my patients. And the thought that they rely on my health in order for them to get healthy and survive the chemo rounds and their treatment can be very stressful. It puts a lot of pressure on nurses, doctors, and staff to follow high standards of PPE. So this is another reason why I continue to be an advocate and continue to speak up, because my health determines how my patient's life will be.
Michelle, you are also a children's rights advocate. You and I actually met through UNICEF Unite. And you're not a spokesperson for the organization, but clearly you and I care a lot for it and the work they do throughout the world for children. Can you share a little bit of what UNICEF is doing currently during the COVID-19 pandemic?
Yeah, I'm happy to talk about that. I'm a UNICEF Unite LA volunteer. UNICEF, they're an organization that their main goal is to give every child the opportunity to thrive in this world without thinking into politics, looking at race, age, looking at sex, gender, culture, where you live. We're looking at just children being children and giving them the opportunity with education, health, access to food, for children to have an opportunity to live. So UNICEF travels globally, and currently with the pandemic going on, they've been on the front lines providing PPE to third world countries. And I know that UNICEF has been in discussions currently in ways to support here locally in the US. And they're currently discussing ways that UNICEF can help because they've noticed and seen the need here in our own country. I'm happy to be part of an organization that continues to be transparent and dedicated to children. We were all children at one point, and I feel like if we can give children some hope and prosperity or an opportunity to live, I'm all about it and in support 100%. And that's why I'm with UNICEF as a volunteer and continue to be there as much as possible.
What has this experience taught you overall on both a professional and human level?
This experience has taught me that public health and healthcare should never be underestimated. When our nation or state is thinking of cutting services to healthcare, FEMA, public health, or mental health services, that should never be an option. People's lives should be taken seriously. We're all deserving of a prosperous quality of life, and also has taught us that we should always take pandemics, viruses, and people's health seriously, and should open up discussions on how we can prepare for the future.
Great. Well, Michelle, thank you so much for sitting down with me today virtually and sharing with us what it is like working in the front lines of this response.
Thank you so much, Lorraine, for having me. If I could just say thank you to all our frontline workers, including farmers, custodians, researchers, warehouse workers, grocery store clerks, delivery drivers, doctors, and of course nurses who are in the front lines right now keeping the U.S. fed, healthy, and happy. I bow down to you and give you many thanks. So thank you so much for listening.
Just like Michelle, as always, I'd like to close off this episode by thanking all essential workers. A special shout out today to all the brave healthcare workers having no other option currently than to save people's lives while putting their own at risk. If our healthcare workers lack proper safety precautions and fall ill, even more people risk losing their lives due to a shortage of personnel. And one can only hope that this pandemic will serve as a lesson and that such a scenario will never be repeated. If you enjoyed today's episode, I'd be grateful if you shared it with a friend or gave the podcast a review. You can follow the show on Twitter and Instagram and subscribe to it on all major podcasting platforms. Thank you, and until next time, I'm your host, Lorraine Schneider.